I have helped many females. So some has breast cancer, is already in a second or third stage. How to cure it is a long process to explain. There's too much. We are having enough time to teach you how to take care of it. You see, how to heal it. I have method too how to heal it, but it's too long process. I will introduce you how to detect. So I see here, maybe husband can do his wife how to detect it to protect you from getting this sickness, right? So the second stage. You see, now I may introduce to you the ideas of reflexology. Ideas of it. You know, I'm working on this. It's already 18 years. 18 years. It's quite a long time. So I developed many techniques how to discover almost. So with visual diagnosis, you see, I can tell you what you have, right? Right, can you see it?
Yep.
It is normally called reflexology. It means on our foot sole, right? This foot sole like this. Now here is there's a left, here is a right foot. Now you see many joints are here. It is called reflex joints. They are related to the organs. Therefore, I can make sure with visual diagnosis, I can tell you according to this map. I think we shouldn't take too long to explain the map of our food. Usually, I think you get you get another paper with 5 pages, like that, yes. It is how to do it. That's really the secret. But for me, I would like to publish it, and let everybody know it, and can handle it by themselves. You see, as I give this to you, I think that's very precious. According to my experiences, you know, very, very good. So now here is our right foot. So maybe you can see it means according to their numbered. Here is called reflex zones. Very different with different numbers. They are really different reflex zones here. Now here is left foot. Now we take here right foot. Left foot is different from right foot. Only heart is left. Liver is right side. So therefore, in the right foot, you find the liver reflex zone. Left foot, you find the heart, especially heart. Now left part. So heart is here. Here's spleen. Here's the rectum, for instance. Here's the ascending column, and here's transversal column. You see over there, our big toe represents our head. If you had any problem, you just go there until you are healed. For instance, migraine, migraine is very difficult to be cured by medicine. So no medicine can help me. Although we can stop I cannot feel the pain anymore, but sickness still inside. Sinuses, for instance, we can cure that. You see, you just find out the reflex zones. Over there, you do something, you get healed. So the healing can come instantly, maybe after some seconds. You see, maybe after 40 seconds, after 1 minute, you're sure you get healed. You see, here is the organs here. Now I will show you most important part is this one. Now, for instance, here we got reflex zones. For instance, here, number 52. Oh. Can you read? Number 52, breast or chest. You see, you can find here your breast around the circle. You see, the circle inside your breast, right? So I will tell you how to manage it, how to do it, how to do your self-diagnosis, self-assessment, to find it. Maybe by yourself it will be difficult, you see. Let your husband do it, or let your sister do it. Only know how. It is so simple, one will be astonished, surprised. It's so simple, you see. Now here, I will only to do this. There's one doctor from Johns Hopkins. He's a father. You shouldn't talk too much, no. You only make data how to discover the initial stage of breast cancer. You will get very famous. Now, the conventional medicine, although there are so many equipment to detect the cancer, but not the initial stage, especially breast cancer. Can find it. Can find it really nowhere. You see, he said, you gave us data, how many you have detected. We will send, the hospital said, we send 3 persons to you, to Taiwan. Let them see, you see. And then they will invite you to come over to Baltimore, right? Hopkins, Baltimore. So you will have so many females here in the States, also in Canada. You see, according to the statistic, white women easy to get this, rather than yellow, like Chinese, especially for the Africans. Fast they have none. You see, there's most white women have these problems. You see, if you can do it, it's marvelous. Secondly, you shouldn't talk about the cure, the healing. There are many methods to heal it. Many. they can pick it up. If it is very small, and you can determine the point where it is, just take it out, finished. Very simple operation. So you shouldn't cut whole breast. Because after the cancer developed, so cut it whole, take it away. That's worse, very bad for the female, So that's, I think I will tell you this technique, how to do it, right? So, and I shall not laugh. Never mind, this is some words, okay? Now many, here in Canada, in the States, I was in New York. I came from New York this time. First Miami, then New York, and now here in Toronto. So many people have these problems of lower back pain. The same way in Taiwan, many suffer this kind of sickness. You see. We have very simple method to give you, for instance, here it is called reflection of spine or vertebra. You see, vertebra to cure it. Normally, the healing process, the sessions, I think the 7 times you can cure it. After first time, first massage or first treatment, so you feel very comfortable. Very comfortable. So you can move so around, twist around, you see, just feel nothing. It may come back little bit. After 7 treatments, you can heal. You can just feel nothing. So very comfortable while you're sleeping, while you're working, while you're, sweeping, sweeping, right? Sweeping the floor. So you feel just good. It's gone. That's very important. Okay, now, second point, now this show you, so those I showed you, normally accepted by reflexologists, normally. Only some points different only. Maybe some put here, other way. So, but normally this is generally accepted. So therefore no discussion among reflexologists. No discussion. So now is how to do it. That's the problem, how to do it, you see. So therefore, if you had got this means how to do it. I think you will have this color copy. Color copy is printed here. So they charge it a bit. I think they charge $10, 10 Canadian dollars. You see now here, that's really the secret how to handle, how to take care of you, how to do it. So I think we have more bunks. Do you see it? It is called 按摩棒. I will introduce Chinese word. into this reflexology. This called Anmo massage, bang, or stick or something. That is very difficult to say English. What is this? Can you tell me the English? Can you tell me what is this? A tool. Too many tools. You see, everything has tool. You see, there's not this tool. This tool quite different. You see, and now for your reference here. So just explain. Here is left foot. How to start? Just got this number. You see, first one we call fluid channel. Second, reproductive channel, rectum channel, small intestine channel. 5A, very important, heart channel. 5A, you find 5A, where is? 5A over here, right? 5B here, this heart channel. Here, circumflex branch of left coronary artery. You see. There's 5B. Where's 5B? Up there. 5B up here, right? So, now I'll give you the knowledge how to start. Therefore, we have the starting point. Here is written initiation point or starting point. So you see starting point is bigger. It's around here. Here's starting point. Another starting point, another starting point, another starting point, right? There's another starting point. So you see starting point, you can see how does it go, how it's going. You see, for instance, here is starting point number 3. This rectum or column. You see a starting point, you cannot go right that way, right? You go how to go? You go here like this way. Here starting point, you go right upwards. You see, there's a resting point. Resting point. What does it mean? Starting point is how to start. What is to explain? Resting point, you just push here, don't move. Rest there or stop there, so till the time is over. Starting point, so it lasts for only 20 seconds. Starting point, initial point, 40 seconds. It's longer. It's longer. So there's it means this 5 pages are telling about this, how to do it. You see, that's how to do it. This is really this experience of 18 years with sum together, put together, only in 1 pages to tell you. Now, the main problem is not yet solved. I called it here point-channel therapy. This kind of method is different from many other therapists or many other reflexologists. You see. Now, the idea, where does that come from? According to my research, you see, for me, the ideas are very simple. Now, please pay attention to what I'm talking about. Very simple. You know, our foot is one part of our body. You cannot say this part of foot is biggest one, bigger than whole body. Can you say that? No, impossible. That's your crazy. You say that food is bigger than the whole body. No, food is part of our body, right? Now here, if you say, if it is true that They are called reflex zones, right? Each zone, for instance, here is heart zone, heart. Surely is smaller the heart itself, right? Do you concede? It's right. It's smaller than the heart. So otherwise, all your organs put into your feet cannot include it, right? Cannot include it. So therefore, reflex zones must be smaller than organ itself, right? Secondly, you cannot say the heart totally sick. Totally. No, not possible. If totally sick, if a liver totally sick, you are finished, right? So it must be certain pathological focus on your liver, in your heart. You see, the pathological focus must be smaller than organ itself. Do you get it? Now to get in my English, to get it? No. To understand what I'm saying, must be like that. It is smaller, right? So, using the hand, finger, you cannot get right in. You can get only superficially. There you touch it only. You cannot get in. Right? So you see the comparison here. If you compare, so how do you call this? Down, huh? Thumb. Your thumb, right? Thumb. You see, compare this. Which is bigger? Thumb bigger or arm palm bigger? Oh, thumb short, thumb bigger. You see, arm palm is smaller. You can see that. If you say arm palm is bigger, your thumb, I think I will get you. You may say nearsighted, right? Nearsighted. So it's a guy who should go near. Now compare it. Arm palm is smaller. It is very sharp, very sharp. Now, doing this, you can get the reflex zones mostly are in muscle layer, not on the skin, If on the skin, you can touch it, right? With your thumb, with a thumb, you can touch it. You cannot get enough into muscle layer. Mostly, the reflex zones get very deep into muscle layer, So therefore, to get into the muscle layer, you should use sharper thing, to get in. You see, our muscle has resistance, Resistance. You cannot so easily get to muscle layer because the muscle has a resistance, you see. So, if you go with this, right into it. So here now, I think you have this paper. Not this one, another one, English. Let me see. You see, there's the same thing I have spoken in VIA Hospital in Miami. VA Hospital. We went to veteran hospital in Miami. I speak the same way. I think I shouldn't read this. I explain to you what I'm saying is inside. Not exactly, so word by word. I cannot memorize all that. I only tell you what I have in my mind, right? So that you may go back, take it back, and read it, right? Read it. That's quite different from other reflexologies. Quite different. So now, with this, you feel pain. How does that pain come? How does it come? our foot is very far, is the farthest part of our body. You see? You say our, how to say, our arms, not so long as our foot, whole foot, especially the foot sole is very far from heart, farthest part. So, with the circulation, the vein, the blood comes up, you see, and to lung, to blood again, to kidney again, it goes around, you see, circulation. So when the circulation arrives, food, certainly something will be left, something. So I don't say dirty. Maybe some parcels or some waste of our body. You see, maybe a rest there. Rest there. So now, because on the foot sole, so many reflexons, where your heart is not good. You see, that's very interesting. What we have found in there, very interesting. You see, and we found there, if heart not good, heart problem, in the heart reflexon is something deposit over there, and it may be parcel accumulated together. You see. Therefore, if I find that parcel, I can tell your heart where your heart has problem, or in the artery valve, you see, or your heart get fat or bigger, get fat. I don't know how to say it. Can detect it. If you get operated in your stomach, I can tell you which side is operated. You see, that's interesting it is. So, if, how to say, if in your vagina is something over there, to, how to say, it is a contraceptive, or something instrument, you see, just like surrounding, put into there, I can find out. Is something there. If a fallopian tube is bound, how to say, it's bound, you see, I can tell you which side is bound. If the doctor take it off, once I take it off, I can tell which side is how to say, separated. Nothing there, fallopian tube is away. I can tell that, you see. There's all these things, so have this, how to say, footstep to follow. Interesting. So that's now the pain come. Where does the pain come from? If you make the channel, the muscle. How to say? There's something. I don't know how to explain it. Like, help me. 挤压怎么讲 ？For pressure, squeeze.
Compress. You know, the muscle have pressure to each other.
Oh yeah. No, I explain it this way. So now I'm going to explain to you with my hand. So you just think that's my foot, right? This really I try to do with my hand. You think about this foot. Okay. Now you see, this amobang goes into muscle layer. What does it mean? If your foot soil full of the parcels or deposits, these deposits are so nicely coordinated in your foot. Very coordinated. Therefore, you go like that. You go by walking. You feel nothing but the pressure, right? From top to bottom. Just like you go like so. You see, you feel nothing pain. If you're barefoot, right, If you want stone, you stepped on stone, you cry, really, oh, it's painful, right? Why? Because of compressing. You see, the deposit goes both ways. You feel pain. If you have small deposit here, it's worse. If you touch it, you're crying of pain. The pain firstly comes from here. They're normally from compression. Secondly, comes from the so-called reflex zone pain. From reflex zone, then you feel pain very sharp, very sharp. Just like you stepped on 1,000 needles. That's very painful. Now, I will tell you one thing. Normally, in conventional medicine, the doctors are also the people, the sick people, are afraid of pain. Now, I would like you to distinguish. Pain comes from sickness, headache, stomach, you see, frozen shoulder. You can raise your arm, that's painful. The pain from sickness, right? It's quite different, the sickness from treatment. First, I'll give the idea that treatment pain is not invasive. You get this word, invasive? You get that? Invasive. It is not invasive. It is not harmful to your body. Frozen pain is harmful to your body. Stomach pain is harmful to your body. Now, what does stomach pain mean? It is a sign that somewhere in your stomach is in disorder. Is in disorder. So it's from the sign tell you, pay attention, your stomach is sick. What you are doing? Your doctor, tell him, doctor, I have stomach. Maybe she gives you pills to stop the pain or to heal the ulcer. You see? Then you didn't feel pain anymore. They stop the pain. Usually, I think the painkiller pills is not so good in my mind, in my conception, because you kill the sign. You kill the sign. Now, this pain, I call it pain from the therapy. You know, it doesn't last too long. Only during the treatment. The treatment is over. As far as I put this away, you feel nothing. So therefore, I call it this pain. So in Latin words, salvific. Do you understand this word, salvific? You understand? Salvific. The Latin words. Salvific, or helping pain, useful pain. It is to heal, right? To heal. This is really healing, healing you, this pain. So this pain go. How does it go? I don't know. But I am sure this pain is related to the organs. Now, for instance, what have been really stomach, very painful. So my brother, you see, in mainland China, once he saw pain, he cannot raise his body just like that. So his hand go like this, walk like that. I said, what do you have? What have you? He said, stomach pain. Go sit down like that, sit down. I told him along the stomach line. just around here. There's 9 channel, stomach channel, just 9 stomach channel. Stomach channel, initiation point is here. Just pull like that way down. It's very deep. But he cried of pain. He cried. After that, after only some seconds, 40 seconds. Know how to feel? Nothing disappeared. What do you feel? He said, a warm stream, you see, comes over. That warm stream, right word to understand. You see, comes over. That's okay, that's healing. So something like that, only some seconds. You see, get very clear. That's the pain, I call it healing the pain. About this, I will give you next time when I have chance to talk again, the explanation of pain, extensive, about pain. So this most important is this. Now, so this I talked about already, only some to add. Now for instance here, 16, that's tonsil channel, tonsil. So many, if you get cold, so normally you have to cough in, so like that. That's a tonsil inflammation. In initial stage, when you feel something here, when you swallow, 口水怎么讲？ Saliva, that's right. Saliva, you see. So just feel something wrong here. Oh, you just take this amobang, you see, just here, in big toe, here, just like that, you see. It gets over. No pills. That gets over. Just do it quickly. You see. That's here for that. You see here, that's for bronchi, right? So this here, this way, this line, 17. Here, although they said here is a lymph system, but it's also for bronchi here. Now to take your attention, if you get a frozen shoulder, there are many places to be done. Here is one of those. So, but here is very interesting. 19, there's a balance organ. You get dizzy if you get up from the bed, you cannot stand up. Why? Because you are feeling, how to say, your room, the ceiling is turning around, so just like that. If you close your eye, it's good. You open your eye, oh no. You cannot get up. Why? Otherwise you fall down. That's very, this is really a sickness. It is called organ imbalance. Now here's organ balance. Let's look at that here. So normally I can cure this sickness 7 times only. Each time some seconds, 40 seconds or more, 1 minute or so. Can cure it 7 times, 7 treatments. So here. Now here for frozen shoulder. Right? So that's all. You see, later on, I think that you have some question in English. I will answer you. Okay. So we have the time. So still, that's good. We have put 1 hour more. 1 hour and 10 minutes. Now, see, English speaking, I think that's, no, I would only give you some ideas of this therapy. It is different from usual accepted reflexology. You see, there's quite different idea that it consists because we should use sharp point to get into muscle layer to the point, right? And to heal there. There's sickness, where sickness stays.
How does it heal? Like you get to the point where there is a deposit of particles, and how does that actually heal the condition which is in the actual organ?
Oh yes, that's very interesting question. That's why in my research, you see, I can only say one thing for sure, because the reflection is deeply related to the organs, right? And through the pain, you say no pain healing, for me, is really ridiculous. If no pain you can heal, I shouldn't come here. I should not come here. Everybody can do it. You see, no pain, no gain. No pain, no healing. The pain should reach such degree so that your organ reacts. Other your organ sleeps, just like normal. The sick sleeps, your organ sleeps. You're sleeping. To wake it up, you should give the pain. Only such pain reach the reflection corresponding organ, and it works. Just like, for example, of my brother, you see, not the richest brother, my brother, you see, of same father, of same parents, right? So when he does so right, can raise his body. If you give little pain, see like that, because the stomach doesn't go away. You reach such point, reach such degree that your stomach reacts suddenly. You see, reacts. And you feel warm stream over there. You see, then the sickness, the pain, the stomach pain goes away. Right? So there's a relation. There's a channel there. So, from reflection to your stomach, the real channel, which is the channel, should be investigated, right? Should further deeper study to find out how does it relate itself to each other, right? For a moment, we can see from the result, right? There must something there, or we cannot explain the result. Now, why these people get healed? For instance, you have headache, right? Headache or migraine, very bad migraine, very bad. So, therefore, you should do such a way. Firstly, you should find the right place of reflection, right place. If I do this sinus, I do your heart. That's your heart reflection, not good. Cannot achieve sinuses, you see. You should do right away in the sinuses reflection in order to get the sinuses, you see. Reflect. So after that, you see, if a nose is closed, cannot breathe freely. You see. In order that your nose is open, firstly, you should find a right reflection. Secondly, must give them enough pain. This way, you shouldn't think that's invasive, not good for your body. No, that's totally wrong according to our experiences. It is really helpful. It is helping your body to react. You see. After the reaction, you feel no pain anymore. But your sickness here, your nose gets open. Suddenly you get this effect. So therefore, the tolerance is very important. To take the pain in, you don't reject. No. Oh, you cannot undergo. You see this treatment. Right? You just take in. You feel the pain. Right? You feel the pain. You take it. So I don't say we enjoy it. You see, some people told that, Father, this pain I can tolerate. It's joyful for me. I just feel it. Oh, it comes. The pain comes, Oh, again, this such a way. Just like before, the same pain come again. It's good. It's good. So do it. It's good. No, if in such a way, many sicknesses, you see, there's doctors in Taipei, they are surprised to see Miss Dong. She was in Taipei with me. So in my practice there, so maybe for 3 weeks or so, something like that. So there, she saw many patients coming in, many, with different cases. And she saw how the people can tolerate. So they say American people or the Canadian people cannot tolerate the pain. No, I said no. The Chinese people, they are human beings, the same like you are. Same like you are. Now they understand what that means because we explain to them what's going on here. You see, they accept this idea and try to feel the pain only, to feel it. You see? And usually used to it. It is good after every treatment. They say, oh, it's good. After that, oh, I feel very happy. You see, my body is enlightened. It's enlightened, you see. Not so heavy at all, very happy soul. That's good. That's it. So I think that's mostly for this time for youth because I stay here very short next Tuesday. So I go back to Taiwan because there are many people waiting for me.
But how do you know that the organ, you say the organ is going to respond, the pain is going to trigger the organ to wake up and respond? Why is the response healing is to heal itself? Why that response? Why does the organ just wake up and shake from the pain? But no, it wakes up and it starts healing.
Very good. No, from the result, so from the duration of the pain, I detect whether or not you are getting better. Surely you can feel yourself, not I'm talking. If I say, oh, you are healed, you say, no, Father, still have pain here. Because I'm wrong, you are right. You see? When I say, now try, see, now how to feel now here. So sometimes the people told me, here pain. Here painful. So this is male, not female. Female is different, From here can come both ways. When there is prostate in serious condition, prostate, right? For female, maybe fallopian tube is too narrow, you see. And according to her age, maybe youngsters, maybe his period is not so not correct, you see. There's problem there. The fallopian tube is different. Once, you see, if I do that, know how to feel. It's gone. You see. And for male, here, female here also, for instance here, maybe his ascending column is moving. Doesn't move. Our movement right back here. They feel very, see, not painful, you cannot say painful. So very, not comfortable, uncomfortable here. So just like you hold here, you see. Sometimes this pain here can go right like this way. So, goes down here and goes down here. Here, you see. Look, the different. I can check it at the foot, which is ascending column problem or not. If it's ascending problem, I just do there, do the reflex on, do there, they got healed. Oh, here, nothing. They healed. And this guy went to a hospital to check. He said, and to check, maybe he has appendix, or maybe his liver is sick. I said, no, just only there, only ascending column. You see, there's a fall. The bowel movement is not good from here upwards, from the transverse column and go to descending column. That's only here problem. I do it, I feel okay. Okay. So, how, I said already, we know there is connection from foot reflex zone to the ascending column. You see, there's some certain signs over there, you can look at. Some certain signs over there. I know the problem is there. Not his liver, not his low back pain. You see? Just to there, there's something connection. Therefore, the pain is necessary. It's very important to get this move. You see, to do the bowel movement. Cool, your body itself. You see, this right go to there. No? Okay. Okay, very good.
So, the question I have is one question related to breast cancer.
Breast cancer?
Yes. Impressed by your diagnostic procedures. However, the question I have to ask you is, according to Western medicine, the mammogram is still the standard they use today. If your method is so proven, have you, are the Western medical doctors, the caretaker, the caregivers, are they incorporating your method into Western culture?
So, you see, not yet. Because our method is most popular, not scientific. We know that. It's not scientific. The scientific method is, for instance now, if I can detect initial stage, understand me? So notice already cancer is completed, is there is. Or in second phase, third phase, fourth phase, is last one, that cannot be cured. You are going to do nothing, you see. Now, the main important thing is to discover in the initial stage how to do it. If I find something over there, your breast reflex zone, you see, I can tell which part or where it is. Let this patient go to make CT, you know, to make CT or the mammogram, right? Mammogram to check. I can write down the figure where it is. Give it to the doctors to check only over there. If see there's something wrong over there, initial stage, there is a sign over there, right? So this idea. After our discovering this, sent the patients to the hospital to make CT. They come back. You see, to heal it, there are so many different methods to heal it, right? So many. If in initial stage, you just operation here, right into here, take it out, just a little bit, you see, you are safe. So, should be so complicated with so many different things. No, just go to hospital, take it, you see.
I'm a marketing professional, and we've seen that your method, we have such an urgency in the ladies of the world. What can you do to incorporate, to get this message across to medical doctors so that they can incorporate it or do a study?
So very good. Now you see, this time I was in Miami. There's one very famous doctor came to me, so he was inviting me to come over to speak to in Miami VA hospital. That's on 12th of this month, October, you see. From 3 o'clock to 5 for 2 hours to speak to doctors. They are working doctors. They come over 20 doctors together, male and female doctors. They hear my speech, you see. And this one doctor told me, Father, okay, so by your way, make it scientific, make it diagnosis, make it data, right? Data. He said, you make data, and John Hopkins, they first come 3 persons to Taiwan to see what I'm doing, you see. And after that, they come back to evaluate it, and they will invite me to go to John Hopkins. So I'm willing to do this. Only I saw this time go back, I make data according to their requirement. Understand me? You see, and publish it in the name of Hopkins, John Hopkins. Yes. That whole world. I think John Hopkins is very famous one in research, research. There are capable people, capable doctors over there. You see, they told me, Father, you shouldn't tell about the treatment. There are so quite different treatment can be used in this case. Only now at present, they have no method to discover the initial stage of breast cancer. Yeah, this I think my method should do it. It is so simple. I will show you very simple method. Why? No, you see, this it is the understanding of reflexology. The reflex, you see, the body reflex, both sides, you see. Ad vicenda, the Latin words. Mutual interaction, you see. The organs interact into reflection acts, you see, into the organ. If I have something here, I can discover that's got a tumor only, not cancer. You say, yes, you should go to the doctors, make the first stage. Go. You see, I will check it. I draw, how to say, the figure, where is, and doctors say, this one, now I should make, how to say, data confirmed by the hospital, you see, by the doctors. They require that. Don't understand? If this is successful, now I think for the females of the whole world, so are going to live better life, after taking off breast. That for females, there's a second life. They feel very depressed. So this, I think it's I'm doing this only because I can make visual diagnosis for many sicknesses, but not necessary. It's only this one. Only this one is more than enough. Right? More than enough. So in other words, many sicknesses can be cured also by conventional medicine. So I don't, I don't deny it. There's also, you see, our second method, alternative method. So people can choose. No, there is another method. I'm to get this method. All right.
I'm just thinking out loud about what you discovered here in relationship to the polio vaccine, the relationship, the importance, the urgency. So I just want to know
so very good.
How you incorporate it and try to educate Western culture. What's the answer to that question?
So yes, very good. Is there another question?
Do you ever use your thumb during the treatment?
No. Only use my amopang
All the time.
all the time. So it go to muscle layer.
And what can you ask your tongue? Ever see how sharp is it?
It is not knife, you know. It is not knife. That is
Ask for everybody.
I think it's good for somebody, if somebody willing to be a volunteer, so father can do a demonstration. Oh, definitely.
So I think not demonstration for her therapy, and I don't have not enough time.
I mean, just
That's
a
only-
segment.
So now I will tell you in wait moments. You see, Teresa, most of you know her. Now she learned quite a lot from me. So I think that if you want to try, now one thing for you important, the pain which we give is not invasive, not harmful to your body. So realize that. First put into your mind. Put into your mind, right? It's not harmful for me. It helps me very much. Helps me to restore my health, to change my health condition. That's all.
Do you also use the hands or no?
No, very sad. Because I have this year, my treatment consists of 3 different methods. One is reflexology. Second one is meridian, acupuncture. Third method is lymph movement massage. This really one massage, very useful. Now to cure breast cancer is very important that way, right? Okay. So otherwise that,
Do you cure any other kind of cancer?
oh, maybe I will tell you very big, great news. Great news. There's I cured 2 cases of liver cancer. Totally healed. Totally healed.
In one length of time.
The one time is about from 3 months to half a year to 6 months. From 3 months to 6 months. Now this guy with 53 years old, you know, that's after discovery suddenly. Every year he went to check, you see, blood test and blood test, you know. Doctor said, yes, okay, that's good. Chinese means okay, just all, you see. Okay, you see. On the 4th year, same time, every year same time, liver last stage with 12 centimeter length. 12 centimeter. I think there's Dong Tai Tai, Mrs. Dong, know him, this guy, know him, he have seen him. He come here to get treatment every day, 4 times every week. So about 3 months after checking. So make CT, make super ultrasonic, WCT, nothing there. The last time only 0.1 cm, 0.7 cm, not yet 1 centimeter, some centimeter, you see. Not yet, but it's totally healed. He got new liver, new vein, new artery, everything is new. It's okay, feel good. But he has luck, you see. He has luck, he's very lucky. Okay.
Have you given any seminars on that?
Sure. I have every year maybe 3 times seminars. 3 times. Now this time we start on 13th of February. February 13th.
You'll be back here.
No, he'll not be back. So maybe next time I go to Johns Hopkins, I will go here around. Just a round trip, right? So from New York to here, or from Miami to here.
The question I have is for those of us who want to learn how to do some practical usage on your method.
Oh yeah.
Where do we go from there? When are you going to be done?
No, for here, no, the maybe next year, I don't know. Oh yes. Oh yes. Now this can do. Maybe one volunteer. No, you are not female. So like a female come here. Oh, that's a firefighter. Let's come here. So bring two chairs, more two chairs over there from behind. Now show how to discover, right? Breast tumor, breast cancer, how to discover it. It's nipple. You see? Just pull like that here. You just feel it. You can put it deeper with more force. You see? Just let go like that. Go up. The feeling from here you feel if there's something stops you going upwards, you see. Pay attention to there. Right? So like that.
Do you feel it?
No, nothing.
Good.
Nothing.
He hasn't come to the point yet.
No. Yes, here. Now come. This, so with Amopang. You see, you just sell it in English, Amopang. It will be international, you see. We accept this word, Anmopang. Anmopang. Pang. Anmopang. Right? It's just like that. You see, just like that. If you feel something here, you just with Amopang do it. Right? So this I just waiting, just like that. I'm waiting you. There's a cream, you know. The cream. 准备照相哦。归看，你旁边给我照几张相片，拿着照相机来玩哦。所以呀，哎呦，来，是有没有手啊？看看到这些。So you pull this. Oh, close.
Andy, pause that now. Raise your hand, lift it.
Okay.
需要用很重力吗？
不要找到就好了，就在这里。
痛不痛啊？
痛哦。
Feel any pain?
Here, need to be not so much. Not so much.
The breast
So
point?
now, if a breast point is here, it's very big. So do you see it? So like that.
In your diagram, there's just two lines.
That's it, yeah.
But you just walk along
No,
those lines.
just two lines here. Two lines here. One line, the second line.
Sharp
You see?
pain.
That here should be put in the middle, middle finger. Here, middle finger, in the middle, so like that. Do you see that? Here the nipple goes around here. You see? Just put it two lines.
But if you're alone, what is the technique if you have to do it yourself?
So if you get this now accordingly, if you have normally a tumor or how to call it?
Yeah.
Tumor or you say some another word?
Cyst.
Cyst. Cyst.
Pocket with fluid in it.
Cyst here. You just, I find here cyst, you see. Just make my finger here to notice here upwards, you see. And I do this line. If the line is very, you can go through. That's okay, nothing serious, right? If you go through, you found here is one point. You see, if you can go through, never mind. If this very small ball, you know, if you go like that, it goes up and go this side or that side. You cannot catch it. They should go to hospital to check it. Right? You understand? It's so simple.
Just have to go straight.
Go straight.
Okay.
You go straight or go through it. You see?
Is it a sturdy person you apply from the starting point to the end point?
No, they're on checkpoint. She not only check. But to investigate, to see whether or not there's something wrong over there, right? Now here is the right foot. Right foot is a right breast. Left foot is a left breast. Now here we divide it here into upper part. Here's the left side, here's the right side. Upper part, you see. Down part is here, left side, right side. Where is? You can determine, you can see where is. You see, if for instance now, I only for instance, but you have nothing to worry. You see, now for instance, how to check. If I find, so one small, like ping pong ball, very small, maybe 0.5 cm, you see, very small. Now here you can detect it, in which side. Now you see, just here, my foot, my hand, my palm, center toward her nipple. Just put on it, you see. Now I should find it, just more like here, you see. Middle, right, left side, right side. For instance, in middle side here, just do that. From here I know where it is. I just pull here inside, that's very painful. It is confirmation that there's something here, very painful. You see? Now, in which stage should it be? I just pull her breast upwards, so, like that. If I can do it, it's okay. If I can do it, it's alright. I cannot do it means there's something like roots. It's grabbing inside, grabbing. I cannot pull up. No way. Just little bit and it's steeper, you know. So this I know which stage. So let her go to the hospital, check it. You can draw a figure where it is. You see, just mammogram toward there. They should not go so around to find it. No, you can tell the mammogram how to take. You see, where is? Just put there. Is simple.
How can you do it if you're alone? If you don't have a partner to actually do it, can one person do it themselves?
Very difficult. Very difficult. Because you see, you so just like that. You see, so do like this. That's difficult. No strength, nothing. You should go from downwards. You see, from here to there. By myself, is very difficult. Very difficult.
But it can be
if
done.
You sure can be done. If you have a girlfriend, so something, or female friend, so on. Let him do. Just show him.
Okay.
Just show him how to do it. That's very important. Maybe here you do every 2 or 3 months. Enough, right? To keep yourself. You shouldn't go to hospital. No, that's not. If you find something there, go to check. Well, not there's something worse there. They said, no, that's good, you do this. Here's how to cure it. Now the second one, second foot.
Isn't use your finger better than use a stick?
Now this you see.
I know that more you sense more, right?
But sure, you should sense it. You sense it from here, now right that way. Good, nothing. Oh. That's, you see, yes, one thing, movement, you see. Do you feel it?
Yeah. It is pain.
Now you see, that's just my hand put here to go through it. You see, nothing on the way. You see, that's on the way. This is safe. If something, so in New York, I find one. I find one. I have found one. You see, that's so I told her to go to the hospital check it. I draw the figure just to check over there where it is. So this tool is good. This amokbang, you know, you can hold it easily. So you can give force. You see,
When you are working on the line, and if you found any lump, and if you can move, and
if it can go through, it doesn't go upside, so go left or right. That's safe. If there's lump, you go right through. That's good. Nothing to worry. Maybe there's something, so not worse. You see, the normal everyone has that.
So if there is something that you can't actually move, then you should go and check.
That's
After the patient checks cancer, I want to heal the breast cancer.
Sure, we can do.
You can do.
So it is after the cancer, the breast cancer is completed. Do you understand me? Completed is completed. Cancer is completed. It's cancer already, you see. It's very difficult to get healed. This operation not secure. You do know why? This goes spread very easily. You see, in the breast is protected by the nature with many lymph nodes. The lymph nodes is over there to protect the breast. If operation, it go very easy spread over. And it goes away, you see, and maybe contaminate other places. So this method is very good. Also the cure, there's also one big technique how to do it, you see. For me, most important now, for the moment, for my data, I should do it in Taiwan, you see, and give to the Hopkins and send over there, you see, for their references. Maybe if they have evaluation, after that, they come to Taiwan to see me, and the lady invite me, make an appointment to go over to Hopkins and to demonstrate to many doctors. That's how to do it. So simple, so the same way I will do that. Because now I have no record, no data, you see. Just like that, no data. The finish, healed. Right? So now I'm making data. Right? Okay. So this is simple. Now you see everybody should get one. I haven't so many. Only some here. You see we get here, they get here, I here. Right? This one. This one useful tool. Yeah?
You said the lung here.
Only here.
Here. But you are having a line, for the line, for 2 lines only.
Not only, not 2 lines. Now you see it's 2 lines, yes. You see you fit here, this covered hole reflects on of your breast. This side also, this side also. The most side is, you see, when I do that, maybe this side is something. I know, just my hand comes over, you see, and do the same thing. To make a line, to make a channel, and to see where not these balls, how to say, swings. It's right, swings. It is swings, you see. That's your attention. Now you see where it is. And go to the hospital to make mammogram. Or to make CT, just your line, you see. Okay. It's in all initial stage, yes?
If like a stomach, you find something, the same thing, the same way you that one problem with the stomach?
Stomach, no. Stomach, no.
You know, I have a pain around here, and sometimes I go along here.
Oh, that's you have a sour stomach.
So can you cure for me?
Oh, sure.
Yeah.
That's easy. That's easy.
It's not stomach or indigestion?
No, it's indigestion. You see, you have a sour stomach.
Yeah, sometimes here.
Sometimes radiates this side, comes here, that radiates.
Yeah, sometimes here.
No, some radiates. Radiates only for radiation. Radiates, you see, not many directions. It goes. There's your sour stomach. Sour stomach. You should eat too sweet, right? Should be too sweet. Okay. Okay. Now I show you this is so simple method.
Colon. It's not the same way
The colon is different. It's difficult. The time too short. They're useless. Only to protect yourself from breast cancer. It's very important. So very good. Okay.
Doctor, can I go to see you to treat for my...
No. I have no time. Just try to find Teresa. Teresa.
I want to come here to see you.
To see you there tomorrow. I am away.
You'll be here until Tuesday.
Until Tuesday. Tomorrow is Sunday. Very busy. Tomorrow lecture over there in the church. Monday, I don't think so. One time is not enough.